Thank you. Now, Senator Hassan.
Thank you so much, Mr. Chairman, and thank you and Ranking Member Sanders for this hearing. And to our witnesses, thank you for being here today, for sharing your experience and your expertise. I really appreciate it. I will just say, as we are discussing the importance of making sure that workers have access to health care, retirement, and other benefits, it is worth pointing out that it's been less than 2 weeks since President Trump and congressional Republicans unilaterally voted to take away the health care of millions of Americans. So I find a little bit of irony in this moment today. I also really appreciate the focus on how to address the need to update our rules and laws to reflect a modern economy. But the thing is, the devil is in the details here, and the details really, really make a difference. Because if you have sat where I sat as governor of a state and talked to a lot of people who've been forced into independent contract status, that 18-year-old kid hired by a contractor up on a roof falls off the roof, breaks his back, and has no workers' comp and no insurance, so the rest of us bear the cost of that. That's a real issue that we have to think about and be careful about. And when we think about association health plans, we have to make sure they're not association junk health plans. Because if all you've got is people with illness and injury in the pool, that's going to drive the cost of that pool up, and they're going to discover they're not covered for a lot of things. So we got to get the details right here. Let me start with a question to you, Mr. Driscoll. President Trump's budget law will result in millions of Americans losing their health care insurance. This bill will also cause health insurance premiums and costs to go up for patients who receive insurance through their job, because the increase in the number of uninsured people turning to emergency rooms for care will drive up costs for all Americans. So, Mr. Driscoll, how will increased health care costs impact the workers that you represent?
As you indicate, the devil is in the details. There's no question there will be cost shifting from what's projected to be the 20 million folks who will lose their health insurance coverage, and that will be the insured plans, such as ours, that will have to absorb those costs.
Yeah, insurance companies, providers are going to begin to need to drive up premiums in order to cover the uninsured costs. Ms. Friedman, women face many obstacles for saving for retirement, including that they're more likely to come in and out of the workforce due to caregiving responsibilities. According to a 2024 survey by the National Council on Aging, less than half of the women and only 1/3 of rural women reported having saved for retirement. Can you speak to the unique circumstances that women face in saving for a secure retirement?
Yes, thank you so much for that question, Senator. It's absolutely true. First of all, as I've talked about, our efforts are working to make sure that everybody gets good coverage, everybody has portability. But right. And that's, you know, Senator Sanders' bill, Pensions for All, would certainly address that along with other approaches. But as you're saying, that the data is abundantly clear that women do lag behind men in retirement income outcomes. There's lots of factors at work. Women still earn less for comparable jobs. They take more breaks from the workforce for caregiving. I know this because I was taking care of my parents. That leads to much lower lifetime earnings, which is going to affect how much they're getting. Widowhood, divorce and separation can disproportionately affect women's retirement income. All of those are really important factors. And also, women tend to live longer.
Right.
So they're going to have to make their retirement income last longer. So all these things are happening that we need to address. And I just want to also say that the Pension Rights Center supports Senator Baldwin's Women's Retirement Protection Act of 2025, and that addresses some of the big concerns that women have.
Yep. Thank you. I appreciate that. One last question for you, Mr. Driscoll. Union negotiated portable benefit plans protect workers' rights while also supporting them with benefits that allow them to stay healthy, care for their families, and have flexibility in their work. What benefits do employers see with these types of plans, and how could we help more employers offer them?
Thank you, Senator. The beauty of these plans for our employers, and I want to clarify this up front, we have employers that employ hundreds, but in some cases we have employers who have 3 employees.
Right.
They get access to affordable health care with low administrative costs that no small employer could take on. Growing the rate of unionization in any given area or any given occupation would give more employers access to the benefits that I think they genuinely want to provide to their employees.
Well, thank you. And I'll also note that unions are also able to negotiate flexible schedules for their employees. Thank you, Mr. Chair.